You know what my son was? He was 30
I'm just saying that it seems like
Thank you.
Good afternoon, folks. We've had all the jockeys on all the thoroughbreds up here. Now we got the person that can open the gates. So that would be you, Susie. Okay, we don't need levity today. I'll call to order the Health and Human Resources Subcommittee and the House Appropriations Committee. And let me, for the members and for the public here and those that are watching distantly, the vast majority of the bills that we have on our docket today, we have already had full and fair hearings. We've already heard from the public. We've had discourse. We gave it some time to allow folks to reflect upon that and get information back to the members. I know there's been lots of conversations. So with the exception of 2 bills on our docket today that have not had a public discourse, we're not going to re-debate those or re-discuss them or have any input from the public. I think I've granted a pretty good amount of time for folks to give have their voices and their concerns reflected. So I do want to deal with these first 2 bills first, though. So the first on our list is Delegate Murphy. I draw the committee's attention to House Bill 285. Delegate Murphy, you have the floor. And I think we know a lot about your bill, but if a lot of us have read it, and if you'll just give us the why we need your bill and what it says, please. 285 deals with temporary assistance for needy families and community college system shall establish. Sorry, hold on. There, go ahead.
The idea is to take unused TANF funds and set it aside to be allocated in a new program. We've worked with community colleges to get this set up. They're all on board, and it would give these kids a certain number. I think they would like to start with 200. They'd like to start with 2 community colleges, 1 rural, 1 urban, and they would like to provide them with funds to pay for books, and to get them started in college, either for a credentialing program or for a program that would someday lead to a degree. It's really a simple concept. I've been working with Senator Stanley on it now for several years. It just needs your okay.
All right. Members have any questions of the patron? Is there anyone in the audience to speak in favor of House Bill 285? Anyone here to speak in opposition to House Bill 285? If not, measure rests with the committee. Delegate Landis, yes, sir.
I see that there's a fiscal impact. I guess I just want to know if there's anything in the governor's introduced budget or if there's anything related to budget amendments related to the $800,000 each year.
We did have a budget amendment. No, but it is not in the governor's.
Correct.
No.
All right. Further questions? Bill? Members, what's your pleasure on this legislation? As the delegate knows and as the committee knows, we do have a balance in the TANF funding. We're going to be looking at lots of different requests from that, and this is certainly going to be considered in that.
I would love for you to consider this ardently in the leftover TANF funds, and there are always a lot of leftover TANF funds. Certainly not enough, but lots.
All right, Mr. Chairman. Delegate Landis, yes,
I
sir.
would move to the table House Bill 285.
All right, it's been probably moved and seconded that House Bill 285 be tabled. That needs a recorded vote. Notice of vote on the electronic board. And that measure to table advances on a 5-2 vote. Delegate, thank you very much for your advocacy for your constituents. Absolutely. Draw the committee's attention to House Bill 1480. Delegate Fillercorn, 1480, dealing with child daycare programs. Good afternoon.
Good afternoon, members of our committee. You all know, you've heard me stand up here before in support of the 1480 and bills like it with regards to child care safety. You all know that it's about, we currently have 14 examples or categories of licensed exempt care. Many do not even include the basic minimum health standards and do not require background checks. And this is all about the safety of the kids. We've had over 60 kids actually die. I think, I urge you to adopt this bill. I think the safety of all of our kids in licensed exempt child care depends on it. Also, with regard to the news, if you all probably didn't have any time since we were on the floor, but Congress passed a continuing resolution just a short while ago to fund the government through March 23rd. They also included in that significant funding increases in certain areas. One of the increases specific relevant to Virginia was child care. And so I ask that you support this bill. I have reviewed with you and spoke to each and every one of you with regard to the fiscal impact here, and it actually is incorrect on many fronts. There is no cost in 2018, that it says right in front of you. 2019, they said there potentially could be Some fiscal impact, it says, quote, "There's no way of knowing exactly how many child daycare programs exempt from licensure are currently in Virginia," but it's incorrect in many other regards, and I would beg to differ with this fiscal impact statement, saying that there really is no fiscal impact here. Parks and Recs programs and school-based childcare programs are actually exempt, even though there's a line item in there or an amount, and you know, so I would hope it's the will of this body to report this bill.
Thank you. Members of the question, Delegate Stoller. Yes,
Mr.
sir.
Chair, I do want to talk about the $6 million and the $138,000. So, there's no budget amendment associated with this, or if there is?
No, there's not.
And you think that?
Follow-up questions?
I'm sorry.
No, you're good, sir.
Follow-up. So you think that the 63 positions is not correct? What part of this did you get
I do not,
correct?
and actually, we do have somebody here who can actually speak to that. I think Grace Reed from Child Care Aware, and also I believe there's somebody here from DSS that can also answer those questions.
Come right on up.
Hello, good afternoon.
Good afternoon.
I'm Grace Reed
So
with
just,
Child
Mr. Chairman,
Yes,
Child
sir.
Care Aware Virginia.
just my question is on the 63 positions.
Yes, we disagree. Basically, the way the estimate was done, it said, you know, there'll be maybe 3,954 additional programs will be identified, but part of the estimate said they actually have no idea. And I think they didn't look at the language in the bill potentially that said we exempt, if you're a school and you run a child care program, you're exempt. If you're a Parks and Rec program, you're exempt. I saw the Parks and Rec people here today, so I know they are here. So they may have done the estimate at a time when those things were included, but now they're excluded. We believe that that there is likely either very little impact or the estimate had a flawed look at how many potential programs that were license exempt that were not exempted in the bill.
Thank you.
Mr. Chairman.
Yes, sir. Delegate Landis.
Delegate Philcorn, you know, the fiscal impact statement was developed by DPB. I'm contacting the Department of Social Services, so whether the, with all due respect to the lady, I mean, that's who we depend on to know whether there's a cost or not.
And Delegate Philcorn, to Delegate Landis' point, and Delegate Stoller as well, there are a lot of great ideas this year. There really and sincerely are. We are still, as you well know, and you and I have had a number of conversations, and I really sincerely appreciate your advocacy for your constituents. But we still don't have a lot of guidance on what that final number is going to be, so that we can put more money towards programs that like this that have merit. So, does anyone else in the audience to speak in favor of House Bill 1480? Anyone speak in opposition of House Bill 1480? If not, the measure rests with the committee.
Mr. Chairman,
Delegate Stoller.
move to lay on the table.
It's been probably moved and seconded that House Bill 1480 be gently laid on the table. The members will vote on the electronic board. And the measure to lay on the table for House Bill 1480 passes on a 5-3 vote.
Thank you, Mr. Chairman, members of
Thank
the
you,
committee.
Delegate. All right, members, and for the public, I'm going to go now through this. You have bills before you that are numerically oriented. And again, for the public and for the members, we have heard all of these measures discussed. We've heard public testimony both for and against these bills. And it's not my intention to hear more from the public today. I think we've given plenty of time for folks to sort of weigh in on this. So House Bill 324, patron by Elliott Campbell, deals with the Southwest Virginia Training Center with prohibited closure of that center. I think the members understand the pros and cons of this and what the legislation does.
Mr. Chairman,
Delegate Landis.
I move to table the bill.
We're probably moving to second that House Bill 324 be tabled. That is a recorded vote. And the measure to lay 324 on the table passes on a 7-1 vote. All right. Next is House Bill 325, patron by Elliott Campbell, which would prohibit closure of both the Southwestern Virginia Training Center and the Central Virginia Training Center.
Mr. Chairman,
Delegate Stoller.
move we lay on the table.
Second.
All right. Been probably moved and seconded that House Bill 325 be laid on the table. if you will vote on the electronic voting record. And that measure laid House Bill 325 on the table passes on a 6-2 vote. All right, and members, I'll draw your attention to House Bill 806, patroned by Delegate O'Quinn. This would also be a comparable bill to Delegate Campbell's to prohibit closure of the Southwest Virginia Training Center and the Southeastern Virginia Training Centers.
Chairman,
Delegate.
motion. Move it, the bill on the table. Second.
Been probably moved and seconded that House Bill 806 be gently laid on the table. Members would vote on electronic board. And the motion to lay on the table, House Bill 806 passes on a 7-1 vote. Members would draw attention at Delegate Hope's Bill 816, House Bill 816, patroned by Delegate Hope. Oh, Delegate Hope.
Thank you, Mr. Chairman. This is Joint Commission on Healthcare bill. What we've done is there's a lot going on with substance abuse data collection throughout the secretariats. I know Governor Northam has indicated in I guess as he took office, in a press release that he was going to designate an individual to collect all this data and consolidate it so that we can have all this information and know what all the different agencies are collected. So that's the bill that's before you.
All right, and again, for the members, as you all recall, we had Delegate Hope on the calendar, but he has been extraordinarily busy running back and forth to all these different committees and did not get an opportunity to give us the why and the what on this bill. So I appreciate that. Any of the members have any questions for Delegate Hope, patrons? Is anyone in the audience here to speak in favor of House Bill 816? Anyone in the audience to speak in opposition to House Bill 816? The members understand this bill and Delegate Sickles.
Mr. Chairman, in light of how inexpensive this is and what great data we can get on this, I would move
Substitute motion.
All right, it's been probably moved and seconded House Bill 816 report. Delegate Hillian.
I'm going to lay this on the table.
All right, it's now, the substitute motion is to gently lay on the table House Bill 816. That's an order of a higher order, and that is non-debatable. So, in the motion to lay on the table, gently lay on the table, is the work done by Delegate Hope on House Bill 816 passes on an 8-3 vote.
Thank you, Mr. Chairman.
Keep working on it, Delegate Hope. All right, draw the committee's attention to House Bill 1102, patroned by Delegate Stolle. This has had a very full hearing, both in health, welfare, and institutions, and as well in our subcommittee dealing with certificate of public need. This would provide some changes to the medical care facilities certificate of need program.
Mr. Chairman.
Yes, sir. Delegate Sickles.
Were you asking for a motion, Mr. Chairman?
Either that or lack thereof, but I would prefer a motion.
Mr. Chairman, I thought that the patron might speak to it, his good bill, but I would, if he doesn't want to, I will move the bill. It's a bill that we've had for a couple of years now, and we need to get our state medical facilities plan up to date. That's one of the primary things this bill does. We talk about COPM reform all the time, but we don't even really have an updated plan on what we need as a state, so that's why I think this is important.
All right, sir. So, I'm sorry. All right, it's been probably moved and seconded in House. Yes, sir. All right, it's been probably moved and seconded in House Bill 1102 be reported. Yes, sir. Delegate Lane.
Mr. Chairman, I have a substitute motion.
Yes, sir. All right.
Mr. Chairman, parliamentary inquiry.
Yes, sir.
If we wanted to report this bill, then this very fine bill, we would vote no on this, is that correct?
So the motion that's before us, you would vote yes, but the motion that's getting ready before us, which is to lay this on the table, the passing fire, lay it on the table. If you wished to have this legislation move forward, I would encourage a no vote on that. Yes, sir. So it's been probably moved and seconded, and it's a motion of higher order that House Bill 1102 be gently laid on the table. That's a non-debatable motion. If members would vote to that. All right. The motion to lay on the table is defeated on a 4-4 vote. And that returns us to the primary motion, which was introduced by Delegate Sickles and seconded by Delegate Stolle, that we report House Bill 1102. And is there, members have any questions to that? Understand what we're voting on? All right, the members would vote. Yep. This would be the measure to report. All members voted? All right, so the measure to report fails to pass on a 4-4 vote as well. All right, I draw the committee's attention to House Bill 1157, offered by Delegate Pillion. This is a plan for services with substance-exposed infants. We have heard a very full and fair hearing as well on House Bill 1157.
Mr. Chairman, I have a motion.
Yes, sir.
Delegate Ingram. I would move to report House Bill 1157.
All right. Members understand the motion before us, by general consensus, I guess, to that point, is to report House Bill 1157, offered by Delegate Pillion. Those members would vote on the electronic board. And the measure to report, John, advances on an 8-0. My vision is not as good. I can't see the zero as well as red, but it looks like an 8-0 vote. All right, sir, thank you very much. That measure does report. Draw the committee's attention to House Bill 1172, patroned by Delegate Pillion. This would create a report and local and regional teams on the state overdose death review process team.
Mr. Chairman,
Yes, sir, Delegate Landers.
I would move to table House Bill 1172.
All right, it's been properly moved and seconded. House Bill 1172, this fine legislation introduced by Delegate Pillion, all the way to my right, be gently laid on the table. The members would vote on electronic board. Thank you, John. And the measure to lay House Bill 1172 passes on gently on the table, passes on a 7-1 vote. Thank you, Dr. Delegate Pillion, for bringing forward legislation. Let's keep working on it. Draw the committee's attention to House Bill 1234, patroned by Delegate Hugo. And again, for the members, if there's public that have come in, we have had full and fair hearings on all of these bills that you now see that are moving, that have been processed by these members. Lots of conversations have been held, and that's why we are in this posture that we're currently in. Members?
Mr. Chairman.
Yes, it's been moved by Delegate Sickles to table House Bill 1234. And seconded by Delegate Ingram. So the motion before us is lay on the table 1234 gently, patroned by Delegate Hugo. Eight to zero. Yep, thank you, John. The motion to lay on the table House Bill 1234, it passes on an 8-0 vote. Next is House Bill 1333, patroned by Delegate Brewer. This is a measure to establish the Kinship Guardianship Assistance Program.
Mr. Chairman,
Yes, sir, Delegate Landis.
I would move to report House Bill 37.
Probably moved and quickly seconded by a number of members on the dais that we report House Bill 1334, offered by Patron 33. That's inside the ballpark for those of you that were not listening to the floor comments. All right, House Bill 3334, the motion is to report. The members who vote on the electronic board? Delegate Ingram, there you go. Thank you, John. The motion to report House Bill 1333 passes on an 8-0 vote. Next is House Bill 1364, patroned by Delegate Austin. This would provide 1362. 1362, patroned by Delegate Austin, would increase the availability of testing services for the Consolidated Laboratory, for the Division of Consolidated Laboratory Services. Delegate Ingram.
I have a motion.
Yes, sir.
I would move that we report this bill.
Second. All right, it's been moved and seconded that House Bill 1362 be reported. All members, please vote on the electronic vote. And that measure advances on an 8-0 vote. Thank you, members. Next is my bill, House Bill 1421, which would prohibit, much like the bills earlier with Delegates Campbell and O'Quinn, it deals with Central Virginia Training Center, would prohibit closure of Central Virginia Training Center.
I would move.
Yes, sir, Delegate England.
I would move that we definitely, the chairman give a late gentleman on that.
All right, it's been properly moved and seconded that House Bill 1421 be laid on the table. If the members would vote on the electronic voting. Thank you, John. And the measure to lay on the table, House Bill 1421 passes on a 7-to-1 vote. Draw the committee's attention to House Bill 1429, offered by Delegate Carol Foy. This deals with collection of data regarding substance abuse for the Department of Social Services. And we've heard. Yes.
Well, I was told to return because there was conversations. The committee correctly pointed out there were going to be updates to the system in the next several years. And so I spoke with Carl from the Department of Social Services, and we agreed to change the implementation of my bill to 2022 when the actual upgrades would occur, eliminating any fiscal impact on my bill.
All right, just a second, Delegate, let me get this before all the members. You're suggesting some line amendments. It says 1429, same bill.
Okay, that's good.
Mr. Chairman?
Let me just get it as proper practice. Members all have before them at their desk the line amendments offered by Delegate Carol Foy on House Bill 1429. Absent a motion, they are not adopted.
Mr. Chairman,
Delegate Sickles.
I move the alignment.
I probably moved in second that they be adopted without objection and by general consensus. 1429 is amended to include these line amendments. If you could tell us, Delegate Carol Foy, what your line amendments do and how they change the posture.
Absolutely. So what my amendments do is actually make the date that the change for the systems to look at what type of substance was reported as to the reason why the child was removed from the home would not start until 2020. And the reason that is, I'm sorry, from 2022. And the reason that is because as the subcommittee correctly identified, there has been money that's been allocated to the Department of Social Services to upgrade their system. So my bill says that they do it now, which would have a fiscal impact because they would need to upgrade and pay for it. However, this money has already been allocated for 2022. So the money is there, so my bill wouldn't actually go into effect until 2022 when the money has already been allocated to that time. The reason why my bill is needed is because they can only collect the information that's required by federal law. And in order for them to collect additional information that goes outside of that, they would need this state legislation to allow them to do it. So in conjunction with the Department of Social Services, we made those changes. There's now no fiscal impact. It would not be implemented until 2022. And it passed uncontested the health welfare institutions.
Mr. Chairman?
Delegate Landis.
Well, Delegate Careful, I would disagree that there's no fiscal impact. You're just putting off the fiscal impact. And we are in fact seeing an upgrade of the system. My understanding is, and until the upgrade is done, this can't be accomplished, I don't believe. So it's, again, I think as I mentioned before, I just think it's a little bit premature.
I believe that Carl may have addressed it. I know that we're not supposed to take additional testimony, but I think he can speak better to it. The way that it was described to me is that the money has been allocated for 2022. What my bill would not add any additional costs because it's already been paid for. What my bill does is says the state legislature now says that you can obtain this information, and that's the difference.
And I think, Delegate Carol Floyd, one of the concerns we have is, or one of the questions that have been raised is whether in fact the department has the authority to do this. And I understand there's some disagreement perhaps in whether in fact they have the authority. But to Delegate Landis' point. All right. Yes, sir, Delegate
I have
Landis.
a motion, I move to table House Bill 1429.
All right. Been probably moved and seconded that House Bill 1429, offered by the patron Delegate Carol Floyd, be gently laid on the table. The members would vote on that. The measure lay on the table passes on a 5-3 vote.
Thank you.
Thank you, delegate. Thank you for your commitment to your constituents. Humbly.
Mr. Chairman?
Yes, sir.
I don't think there's any other items of business on your.
I think we have one more,
One more?
but I'll accept the motion if you have one there.
I'll wait.
Okay. All right, I draw the committee's attention to House Bill 1507, 1507, offered by, or patroned by Delegate Les Adams. This establishes the Patient-Centered Medical Home Advisory Council. But again, this is measures heard, been heard quite extensively. Delegate Adams has been a staunch advocate for trying to come up with some clever solutions, particularly down his way, to address some of these needs. Yes, sir, Delegate.
Yes, Mr. Chairman, based on $800,000, I would move that we lay this bill gently.
All right, it's been probably moved and seconded that House Bill 1507 be gently laid on the table. Members would vote on the electronic board. And the measure to lay on the table passes on a 6-2 vote. All right, Member St. Gross, Delegate Landis.
Mr. Chairman,
Yes,
we
sir.
voted on the prevailing side, which we tabled House Bill 1234. I would move that we reconsider that vote.
All right, probably moved and seconded that we reconsider the motion by which we tabled House Bill 1234. All in favor say aye.
Aye.
Any opposed? All right,
Mr. Chairman,
Delegate Landis.
I would move that we continue under Rule 22, House Bill 1234 to the 2019 session.
All right, been properly moved and seconded that House Bill 1234 be carried over under Rule 22 dealing with this topic. So if this is a voice vote, so all in favor, please say aye.
Aye.
Any opposed? All right, members, you have done a yeoman's work, and I sincerely and humbly appreciate it, as does the Commonwealth of Virginia. Our committee will rise.